let me take this chance to welcome everybody, and it's really great to see some of you. If I haven't seen in a while, to see you again. I think most of you, probably all of you, know about the center, so I'll just give a quick discussion of what the center is, since I don't think I can't just not say anything. We've been around for 40 years now. We were started in 1982 by the JDC at the request then of Prime Minister Menachem Begin, and we are part of the JDC family still. We're independent from them, but we are still part of it. And what we do is we carry out high-level research in all the fields that are very important to Israeli citizens, which deals with health, education, welfare, demography, labor markets, macroeconomic policy, and we're pushing into some new fields that we're looking at in the future. Things that include things like the environment and family household debt, things that will be very important, that are very important to Israelis in general and to Israeli society as a whole. Our research is always unbiased. We make sure we stay very apolitical. We will not take any kind of government funding at all. And we make sure that we cover the bases, that we cover things very clearly in terms of pros, things that are working well, things that are not working well. And we've been doing this for, as I say, for 40 years now. Just let me tell you that we have, since the time here is for Alex, I don't want to take too much of his time. Our newest publication, the latest one, our bestseller, we don't sell anything, but our bestseller is the Picture of the Nation book. Some of you who we mailed it to already, I'm sure, have received a hard copy. Those of you who are not, it's always available online, and Michal is sharing it with you inside the chat, so you should be able to link to it. And I think it's always a fun read. And I say that not only because I'm the one who writes it, but also because I really do think it's a fun read. So let me just introduce you to, and if you want a hard copy, by the way, then just let Michal know in the chat, and she'll make sure to mail you one. I'm really happy to introduce, most of you know him already, but to introduce Professor Alex Weinreb. Alex is the research director at the center. He's a leading demographer. He was until recently a professor at the University of Texas, Austin. He's moved back to Israel, and we are thrilled to have him at the center. And he's doing fantastic work for us. What he's going to be showing you is talking about a little bit about what happened with COVID mortality internationally, and to show a really, I guess, unexpected or surprising result with respect to how women leadership and how mandatory military service affected the level of mortality from COVID. And as I said, the results were and are surprising, but they're very important and very eye-opening. Alex, with no further ado, take it away.
Thank you very much, Avi. And I'll leave it to the audience to see if to say if it's surprising or not. Certain aspects of the results, I think, are, and certainly the magnitude. But let's I'm going to share my screen here. And okay, so so let me just start by saying that, you know, from the early days of the COVID pandemic, the Taub Center was tracking the effects of COVID on Israeli society in all sorts of ways: healthcare system, employment, welfare, education, etc. What I'm doing in this paper is basically the flip side of that. Like it's part of an effort to try to figure out the factors which have affected countries' abilities to manage the pandemic. And there are a couple of things which make this important. One is a general thing, which is it's been a fundamental point in the social sciences for at least 100 years that crises are always a wonderful thing for social scientists, because they provide a window into society's strengths and their weaknesses. So that's a general thing. But the specific reason is also because we are unfortunately, for all the blessings of this era, we are living in an era in which pandemics are becoming more frequent. So this makes it all the more important to try to figure out these sorts of factors which lead to more or less success in confronting pandemics. This is a widely recognized problem, and this leads to part of the context for this particular study. In some ways, the trigger was what happened to something called the Global Health Security Index. The Global Health Security Index was something which was put together over several years prior to 2019, when it was released. It was put out primarily by Johns Hopkins in collaboration with a bunch of other major players in the international public health field. And what it tried to do was build an index which would measure countries' abilities to confront pandemics. So they collected data from every country in the world, and they combined them into 21 major categories containing about 80 variables, and then they built this index, and they released it with some fanfare in September of 2019. COVID-19 then was this perfectly timed field test, and it became very, very clear basically that the GHSI failed because the countries in those first months of the pandemic, leading into the summer of 2020, it was clear that countries which had scored higher on this index actually had higher rates of infection and higher death. So this led to considerable soul searching on the part of public health experts internationally, because they were basically asking, what the hell did we do wrong? It didn't help when President Trump in February of 2020 used one of their slides and said, "Don't worry, everybody, we're number one." And because the US was ranked number one, it was ranked by the index as the most prepared country to confront any pandemic. So subsequently, there were calls for social scientists to try to understand and to identify other aspects of social and political organization which would help countries successfully minimize the impact of pandemics on public health. And that's really where we step in with this research. So we're focusing, as implied by the title, on two variables which don't typically make their way into measures of countries' readiness to confront anything. But the argument in this research is that they should be. One is women's leadership. This builds on a long-standing literature in the social sciences, mainly in political science, some in sociology, which has been trying to distinguish the ways in which either cities or districts or countries led by women take different paths. And so this has been an ongoing concern or focus of research for quite a long time. When it came to COVID, it was there were some people who leapt on it immediately, and because within a few months it seemed pretty clear that those few countries in the world which do have women leaders, at least some of them seem to be enjoying a much easier time in terms of infection rates, and the mechanisms which were sought to lead to this, basically they divided into two. Some mechanisms focused on the leadership style. Women, were some said were better at striking this balance between empathy and science. So it was less of this what they framed as a masculinist urge to dominate the pandemic. And then there was a second set of mechanisms associated less with style than with specific decisions. So women leaders may have been more prepared earlier to use lockdowns to enforce mask wearing, etc. So these assertions they entered quite quickly into the COVID literature. The second variable which we wanted to focus on is is mandatory military service. There was no focus on this in public health at all. There's very little literature on this because very few people in public health or in social policy in general in Western countries want to talk about the possible positive effects of military anything. There are some voices, but they tend to be sidelined on the right of the spectrum, and for the most part, they don't talk about health either. But if you read broadly, and especially read the literature which was emerging as the COVID pandemic was spreading, there are a bunch of possible resources which are embodied in a conscript army, which could, in theory, help countries manage a pandemic. One of these is there's a surplus of young men, typically young men, that can be retasked. So there's stories from Taiwan and Korea and Israel, I mean, all of which are countries which have fairly lengthy service of soldiers being retasked to clinics, to enforcing lockdowns, to factories to create basic supplies. So there are these sorts of things. A second mechanism is people in countries with mandatory service are used to being mobilized, and this is part of what's known as the school for the nation idea. And then the third factor was there is some evidence out there, including papers which we put out in 2016, which suggests that countries with mandatory military service, 30, 40 years later, the men have better heart health. So there are potential long-term health benefits. And as we know, sort of COVID mortality selected on things which are not good heart health. So that's, those are some grounds for thinking about why we should expect to see some effect if we compare countries which are led by men which do not have any mandatory service to countries which are either led by women or countries which do have mandatory military service and presumably longer service, because the longer you're in the service, the better trained you are, the better your heart health, et cetera, et cetera. So to do this, we put together a data set which has data from 174 countries, basically every country in the world with at least 1 million people, barring North Korea and a couple of outliers. And then we incorporated into that data set like a few different measures of mortality, and we're talking about cumulative mortality. So how many people died each month over time. The first is what was originally the most widely known data, which is a direct estimate of COVID mortality put out by Johns Hopkins. So we use that. So every month from March 2020 until May of 2022. The big problem with these data is that they underestimate total mortality because there are many countries which simply do not collect good data. So we can't rely fully on those. We therefore supplement two different sources of what's called excess, or their measures of excess mortality, which is basically the difference between the observed number of people who died in a given period and the expected number based on what we know about those same countries from 2015 to 2019. So the first of these, which is basically the gold standard, is from a research division called the International Health Metrics and Evaluation Project at UW, and this is largely a Gates Foundation project, and it's amazing, and they do fantastic things. So that's our gold standard. The problem with that is those data are only available up to December of 2021. So we also supplement a different measure of excess mortality from the Economist's research team, and those are monthly. So those are our death data, and then we want to know, okay, so what's the effect of women's leadership? There were in 2020 only 10 countries which had a woman leader. And by woman leader, I mean an executive leader, the person in charge, not a female figurehead, like the person who sits at the top of the power structure. So there were 10 countries. There were a number of other countries which had a woman leader for a considerable period during the 2000 to 2020 period. So we also use that, which allows us then to see if there is an effect of gender of leader. Is it restricted to having a leader just in 2020, or would it also be good if you had for, let's say, for more than 4 years, sometime in the last 20 years? For mandatory military service, we wanted to focus on lengthy service. So we distinguished between countries with short service. There were 38 countries like that, and 14 countries which had service for at least 19 months. And here we find quite an array of countries of different, in terms of region and development status and wealth. Like, I'm not going to talk about sort of methods in any big way, but we needed to control for all sorts of other things which could potentially be captured by women's leadership or the mandatory military service. So we control for a country's wealth and the number of physicians per capita, their health spending as a percentage of GDP, military spending, their score on the GHSI, and the proportion of the elderly, which obviously affected their mortality. There are all sorts of other variables which we tried, did not have any effect, so we left them out of here. All right, so I'm going to show you two sets of model, or the results from two sets of models. And just so we're on the same page, the first set is focusing just on data, the cumulative mortality up to the end of December 2021. So basically the first 21 months of the global pandemic. And here I'm going to use, like I say, all three sources of data. And then I'm going to, so we can look at the variation across time. I'm going to use the data from Johns Hopkins, which is the direct measure of mortality, and the economist's measure of excess mortality, and there we'll see, we'll see the graphs across time of these emerging differences. Okay, so series one. So let me first describe what I'm doing here. So these are what I'm presenting here are the predicted levels of mortality as measured against the y-axis. So there's a number of deaths per thousand predicted by the model. And in each of these lines, so the little dot somewhere towards the middle is the predicted mean for a group of countries. And I'll explain the countries in a second. And then the line above and below that dot is the predicted 95% confidence interval, which is a measure based. That's the measure which we use to see if something is statistically significant, or the difference is statistically significant from a reference group. The only thing to note there is because the number of countries with women's leadership is very small, and the number of countries with military service is also quite small. So we expect to have really, really large confidence intervals. So I'm going to focus more on the mean. In this set of graphs, I'm also going to focus more on the middle cluster. Because these are the gold standard data. These are the data from the International Health and Metrics Evaluation Project. But I just want you to pay attention to the fact that the trajectory, like across each of the three vertical bars, is the same, irrespective of which mortality data we're using. So if there's a difference between them, it's in almost all cases, it's just a difference of the height that they reach. Okay. Okay, so what are we seeing here? So, did a country, or what was the level of cumulative mortality up to the end of December 2021 for a country that had no woman leader? That's the small vertical bar on the left of each. I don't know if you can see my mouse. but on average, about 2.6 deaths per 1,000 in the population in countries with a male leader. And if there was a woman leader, then the mortality was, as of December as of the end of December 2021, the mortality was less than 1.5, and in wealthy countries with a woman leader is even less than that. And like I say, it doesn't matter whether we use the direct measure of COVID deaths or the excess mortality, we're finding the same effect. It goes much, much lower in countries with a woman leader in 2020. Okay, how about years with a woman leader between 2000 and 2020? So here we're comparing the short vertical bar on the left of each cluster. This is again, that's for countries which did not have, or which had countries which had a male leader for the whole period. Then the other bars are countries which had a female leader for at least 4 years. And again, we see an advantage in terms of mortality. So both, if countries had a leader only in 2020, so which implies there was something about decision-making in 2020, or if they had at least 4 years of female leadership in the years leading up to the pandemic, they were in a much better situation in terms of mortality. Mandatory military service. Again, here we're focusing on service of at least 19 months. So it's lengthy service, and we find so the small bar, again, the small vertical bar, we're at our standard mean. These are countries led by men or women. Actually, sorry, it's led by men in this model. We're not seeing the women led countries here, and then as we go to countries which had lengthy military service, that's the middle bar. It goes down considerably. But if we limit it to wealthy countries which had mandatory service of at least 19 months, we've gone from 2.6 deaths per 1,000 to less than 1 death per 1,000. So basically, the story which is emerging as of December 31st, 2021, and it's irrespective of which mortality data we are using, the Johns Hopkins or the gold standard or the Economist, it's the same, it's finding the same basic result. All right, what happens across time? So like I said, this is the second series where we're replicating the same model month by month, and we start here in July of 2020, which is you can see on the left-hand side of the bottom axis, and we go. So we replicate the model every month until May of 2022. So let me just tell you what's going on here. So on the y-axis, like we saw before, you have deaths per 1,000. And here in this graph, this is the Johns Hopkins data. So this is the direct measure of COVID. The black line at the top, this is the reference group. These are countries which had a male leader in 2020 and no mandatory military service. The yellow line is countries which had mandatory military service of 1 to 18 months. That's all countries. The next line is 1 to 18 months if they were wealthy countries. At the bottom, you have these basically unrealistically low levels of COVID mortality as measured in the Johns Hopkins data in two groups of countries. One, those with mandatory military service, for at least 19 months, and the other are countries which were led by a woman in 2020. So huge gaps, obviously. But again, like I said, the problem with the Johns Hopkins data is that they tend to underestimate mortality in a non-selected bunch of countries. So we did the same thing with the data from the Economist. These are the measures of excess mortality. The only thing which we need to focus on here is, okay, so there's the black line, that's that's at the top, that's the reference group, countries with male leaders. Most of the other colorful lines are close to it. There's no substantial difference by May of 2022. But when we look at the bottom two lines, the same purple and blue, we see that this advantage of having had a woman leader in 2020 and or mandatory military service, if you are a wealthy country, is really quite profound. I mean, it's a very, very substantial difference in mortality. And it's just to show that what the numerical implications are of this. And this is the last thing which I'll show you, and then I'll summarize. Here's the top 10 plus Israel. The top 10 countries in terms of the reported number of excess deaths as of the 31st of May 2022. So in India, more than 6 million. The US comes in third at almost 1.2 million deaths, that is excess deaths. If, based on this model, if the US had a woman leader, then the number of deaths would have been about 709,000 instead of close to 1.2 million. If the US had mandatory military service, deaths would have been 700,000. In both cases, for roughly 460 to 470,000 less. Over these top 10 countries, there were 13 million deaths. If there was a woman leader, potentially, based on the model, would have saved 4 million deaths. In Israel, things are a little bit different, because we had mandatory military service. So we had around 11,200 deaths. The same model implies that if we did not have mandatory military service, we would have had close to 19,000 deaths. So anyway, this is a model, and it's we'll talk about how realistic this is in a minute. The other thing which I want to mention specifically to Israel is that, again, the two most, and there's no other word for it, the two most patriarchal subpopulations in Israel, in the sense of being exclusively led by men, are also the populations with the lowest level of participation in the military. We all know who we're talking about. They experienced higher rates of COVID morbidity and mortality. In the context of this analysis, it's conceivable, at least, that those higher rates were at least partly driven by the lack of any benefits of either women's leadership in any public sense or mandatory military service. But of course, the more general question is to look beyond COVID. What other potential benefits would we see from these two things if we look? Sometimes we do look, but maybe not widely enough. The bottom line of this research is, and this is what appears in the actual paper. In summary, it's like most contemporary countries are not led by women, nor do they have mandatory military service. That is unfortunate, at least in terms of mortality rates during the COVID era. Countries led by men that chose not to conscript their young for at least 19 months paid for these privileges with substantially higher mortality. But of course, what do we do now? Well, the first thing, and this is, we have to, anytime we're talking about turning any piece of research into something which is policy relevant, it's not enough to show a connection. You have to identify the mechanisms which you think explain that connection. That's the first thing which we need to do. The second thing is, well, in the meantime, we see there is an effect. So we can elect more leaders who employ these mechanisms, which is, those don't have to be women. I assume that they can just be, they can just be leadership styles, which right now tend to be more associated with women. But there's nothing to stop, enterprising political entrepreneurs from taking advantage of or from using those same approaches. And then the final thing, which I'll say just for, just to get us going, is there are voices emerging calling for an end to mandatory military service in Israel. And I would be very wary of taking such a step. There are all sorts of unintended and positive health externalities. And what we've just demonstrated here is one, but there are some others, I think, as well. So I'm gonna firstly thank you. I look forward to questions and talking.
Well, thank you, Alex. That was absolutely fascinating, at least to me. I think to everyone here. I saw a lot of heads nodding. I don't see a lot of heads, but the heads that I saw nodding. And so let me open it up to questions, and just raise your hand and I'll call upon you. Michael, go for it.
Alex, that was really interesting and an epidemiologist's dream come true. I really appreciate your presentation, and the findings are very intriguing. I did want to ask your thoughts about causality. When you showed the comparisons with the 95% confidence intervals, there was a lot of overlap. Maybe for people that are less familiar with that statistical description, where there's an overlap, it means we're not really sure that the differences and that those dots, those estimates, are real. And there's quite a good chance that we found some of those differences purely because of chance and not because they're in fact real, or what we call statistically significant. On the other hand, they did repeat themselves across the different data sets, and that does provide some measure of increased confidence that they may actually be there. But I wanted to know if you could talk a little bit about how confident you are in the results and in causality, because the data sets were small and it may be difficult to reach conclusions based on such small data sets. But again, really, really intriguing, and thank you so much for the presentation.
Yeah, thank
Alex,
you.
We'll take them one at a time. So why don't you go ahead and answer that, and then I'll call on Sandy.
Can I just share my screen again?
Of course.
All right, one. Okay, so let's talk about this in terms of the overlap. All right. So I'm going to go to women leaders first here. So you're right. There is in most of these models there is some overlap, like between the final line and the first line. And I'll just scroll some, but not in all. So this is the first thing. Now the problem with using the standard threshold for statistical significance in this case is that when, for example, we're dealing with wealthy countries which have mandatory service, we're down to a sample of 6 countries, and which is not a reasonable it's not a reasonable statistical test. You can't say, okay, we didn't find statistical significance. Of course you didn't. If you do a power calculation, which we did, in order to find statistical significance with a sample size of 6 and the other group and the reference group being something like 150, the group which we're interested in would have to be roughly 20% of the score of the reference group. So we're, in most of these cases, we're in the 20 to 30% range. So and like you say, it's extremely stable. It's stable like across different sorts of models. So we're sort of going for trying to avoid being trapped by this type 2 error type of problem. And we're just saying, okay, we're going to repeat the model as many times, and we're going to see how things pan out. In terms of causality, there's another, I think, more serious problem, which is the sorts of countries which have a woman leader it's not a random selection of countries, right? They already have certain historical and political traditions different. So I didn't talk about that here. We try to control that or in a whole bunch of ways, but the normal ways we do that, because our sample size is so small with two-stage models and selection models, we simply don't have statistical power to do it here.
That's a really great explanation, and it sounds like this is a great place for like a hypothesis generation, where maybe like this is a kickoff to really go. And I think those are some of your recommendations at the end, right? Is that this really needs to look into this further, but it's certainly a really, really intriguing place to generate a hypothesis about the effects of military service and women leadership. So very, very exciting and a lot of food for thought. Thank you.
Thank you.
Super. Thank you. Thank you, Michael, and thank you, Alex. Sandy, I thought so you had a question.
Yeah, I actually have 3 questions, which perhaps no one else is wondering because they know the answers, but I will put them out anyway. I didn't see any control, and maybe I missed it, for comorbidities. For example, in the United States, we have a lot of obesity and type 2 diabetes, which we know is a problem for COVID. So that's one. The second is, I'm wondering if at the end of your recommendation, it seems to me, and I wasn't at the session where you really talked about the health benefits of mandatory military service. I'm wondering if mandatory national service would provide, because it seems to me that the 3 things that you looked at also could be provided with non-military, but some kind of conscription, which to Western sensibility seems more palatable. And then the third one is it possible to model, and I know that there are probably 0 countries that are like this, with a woman leader and required, okay, so that's my third.
2 countries, yes.
Okay. So those are my questions.
Yeah. Okay. So, well, thanks, Sandy. Those are great questions. Yes, we desperately wanted, only for scientific reasons, to have there be more countries with both a woman leader and a mandatory service. There were, as of 2020, only 2. So that was, so as generous as we're being with our statistical power, like we couldn't sink that low. The national service issue, I think it's a very reasonable suggestion. I think the health benefits, so it depends which of the mechanisms we're targeting, right? So I mentioned, 3 possibilities with, so I have a new kitten which my kids picked up from a local trash here last month, and is now healthy. And I mean, those of you who've been to Israel know that we're full of cats. So the first mechanism for military service was you're able to retask people to help. If there's lengthy enough national service, absolutely, that could work as well, right? Especially if some of them have medical training, because remember, in every combat unit in Israel, which is typically 12 people, one person goes like a 3-month course, so they can be the medic. So the military service, it builds in some level of medical training, which would not be available in most forms of civilian national service, but could be and maybe should be. The heart health issues or the heart health consequences related to national service, again, for people doing forest work or trail building or those things, absolutely, they're going to be in great shape. So it really depends what sort of national service it is, but I could completely see it having most of the overlap. Finally and briefly, the comorbidity issue is really important. In this paper, we don't deal with it. This is one of 2 papers. The second paper is a much more technical paper, and it deals with case fatality ratios from COVID. And there we have to limit the data to limit the analysis to 90 countries, because only 90 countries have data which are good enough to be able to address the question which you asked. So there we're much more careful to incorporate prior rates of heart disease, pulmonary infections, and a whole bunch of other medical conditions which were shown to be shown to positively select higher levels of death.
Thank you, Alex. Additional questions?
I have a comment.
Sure,
Can you hear
Steve.
me? I just want to say, first and foremost, I don't have a medical background or a research background. I am blown away by, your research prowess from first of all, designing the study to second of all, explaining it to people with different levels of background. So that's just a broad statement, and thank you. The question is now, does anybody else do this kind of research? And do you review it with them? And what happens with this research now? How do we share it with others? And what kind of life does it take on to learn and react to?
Alex, okay, you're gonna leave that to me. Okay, that's fine. Yes, absolutely. We do. First of all, have other people done this research? Not the paper that Alex has done here. Nobody that I know of has looked at the questions. Certainly not with respect to military. Obviously, what we saw during COVID was what stood out was, I think New Zealand was the one that stood out the most, where everybody was talking about how incredibly New Zealand did and how they had this new young female prime minister who really did a wonderful job, and how well that was. And that's part of what sparked the question, I think, because a lot of people were talking about that specific issue. I assume that there are others who have asked this question. I don't think they've tried to answer it in the way that Alex did. And certainly they have not looked at the military question, because that would not be, I don't know, maybe not politically correct to ask that question. But we are willing to fly against the wind. What do we do with it? Well, this type of thing can be published on a number of different levels. First of all, Alex is a demographer and been worked in the Department of Sociology, and it's very likely that this is a type of paper, certainly the more technical one, that would be publishable in a top journal in the field. That would get out, of course, to the academic world and less to the everyday world. But we will be publishing this paper in the near future. This is an as yet unpublished paper. We will be publishing this paper from the Taub Center in the near future. And then we would, of course, do what we always do. We make sure that it gets to the press, and we make sure that it gets to the decision makers who have anything to do with anything, and make them aware of the results, and set up sets of meetings with different types of people in order to be able to get the message out. And there are some important messages to be gotten out. And therefore, that's what we try to do with every piece of research that we put out. Did that answer your question, Stephen?
Yeah, fully. Yeah, thank you.
If I can just add as well, firstly, Stephen, thank you so much for those. Lovely compliments. They're really meaningful. So thank you. And one of the reasons I left academia is to be able to have my research, influence discussion and also processes. And this is a sort of paper which is big picture processes, right? Guys, elect more women or have more women's voices. That's something which, even if we don't understand the mechanisms, it's sort of it's implied. But also maybe try to think of other things which are outside the normal box. So look around the world and try to figure out which countries did well, and then it's like, okay, what things distinguish those countries? And that's basically what we did. So having a more global eye for patterns, and that's certainly something which we do at the Taub Center, because in order to be able to locate Israel in a range of things, we're always trying to compare it to a whole bunch of other countries, and it's not always the OECD. So yeah.
Yeah,
right.
no, I think you've done a great service, which is putting out this information, share it more broadly, let people debate it, refine it, argue over it, and then see what positive can come from it. So
right.
Thank you.
We would ask you to sit on this information for now, because we haven't yet published it, but that will be coming out, we hope, in the very near future. Let's take, I think we have time for one more question. If anybody wants to, Lisa's having too much fun in Central Park.
I haven't actually made it to the event yet, but I'm close. But this is really fascinating. Thank you for sharing this today.
Well, we're really glad that you joined us and everybody who joined us. If there are no more questions, then let me again just thank everybody for attending us. I hope you found it informative and you found it interesting. Michal is putting her email inside the chat. If you want to sign up for our newsletter, we put out once a month, put out a newsletter with lots of interesting material showing you what's going on at the center and what new pieces of research we put out. If there are other pieces of research that you would like to get a hold of, we're happy to send it to you. And if you have any questions that come up to you after we've hung up and things spring to your mind, and you say, oh, why didn't I ask that? Then just send Michal an email and she'll be happy to send it over to Alex to try to get an answer. Let me thank you again and just wish everybody a Shana Tova. And we look forward to seeing you at our next such webinar.